New data shows which neighborhoods in Austin are most at risk for seeing severe cases of COVID-19.
Researchers at the University of Texas Health Science Center in Houston mapped out the areas where patients who get COVID-19 are more likely to develop serious infections, needing hospitalization, critical care, and ventilators. KXAN investigators worked with the researchers and the NBC5 investigative team in Dallas to show us how the maps work. And our investigator Avery Travis has more on how it could help city leaders prioritize resources.
Heart disease, stroke, COPD, asthma, diabetes, kidney disease, and obesity. With every move on the map, a closer look at how these underlying health problems are putting certain Austinites at risk of more severe infection.
Special circumstances that lead to hospitalizations.
Dr. Stephen Linder and his team looked at government health data to map the areas with the highest prevalence of these chronic diseases and risk factors.
The way populations are concentrated, sometimes by age, sometimes by race and ethnicity.
He says these maps could help city leaders target resources to the areas in red.
We could potentially predict where the highest need would be for hospitalization and for ventilator support.
In Austin, the data shows hospitalization needs are likely to be the highest in parts of East and North Austin. Experts at the advocacy group Measure aren't surprised with the results, saying the data reflects systemic issues with roots deeper than this pandemic.
Food options that are in those communities, that factors into their health. Just access to safe green spaces. Those communities tend to have a whole lot less resources, even financially.
Many of the red zones of risk in Linder's data overlap with areas where poverty levels are higher.
Needs within those communities, transportation, whether it's being able to have a safe place to be able to stay during the crisis, if you even have an extra bedroom that you can isolate yourself.
This week, Measure is sending out a survey to hear from these communities directly.
How it's impacting them and their families.
Mayor Steve Adler told KXAN they are most closely watching the east side of town.
If we have parts of our community that are afraid to go to hospitals because they're afraid they might be deported or leave the country, if we have families that are living together, more people in a closed space.
Avery Travis, KXAN Investigates.
We worked with the researchers to build an interactive version of the map. You can take a closer look where your neighborhood falls online right now at kxan.com under the Investigates tab.
The UT research does not show how likely someone is to be diagnosed or how many cases have been diagnosed in certain areas. But the city is tracking that data online. The zip code with the most confirmed cases is 78705. That encompasses West Campus in Central Austin. There are 55 confirmed cases there. Several zip codes in South Austin have more than 30 cases apiece. That's the case also for the 78660 zip code in North Austin, which has 30+ cases as well.